everybody high. Strict lipid-lowering diets and medications are predominantly effective for atherosclerotic disease caused by endogenous liporegulatory dysfunction, a breakdown in how the body internally manages fat. In reality, such primary metabolic failures characterize only a small percentage of patients. Consider the natural world. When you buy full-fat dairy products, remember they come from cows, goats, or other ungulates. These animals are naturally strict vegetarians. They never consume fatty foods. Yet, despite a diet devoid of fat, they produce milk rich in lipids and maintain significant body fat stores. Similarly, consider vegans. As previously discussed, vegans strictly avoid animal flesh and byproducts. They consume zero dietary cholesterol and very little saturated fat. Yet, clinical observations often show that their blood lipid spectrum, their cholesterol profile, can be surprisingly similar to that of omnivores. Why is this? The answer lies in our basic physiology. Everything we consume is metabolized in the intestine down to its smallest molecular components. These elementary molecules are chemically distinct from the complex atherogenic lipoproteins found in the blood. The lipoproteins found in our bodies are not simply eaten. They are synthesized by our own biochemical processes. They become atherogenic, plaque-forming, only when these internal processes are disrupted. This disruption typically stems from specific hereditary conditions or acquired damage to the genetic machinery, often, for instance, following severe viral infections, rather than dietary intake alone. What is the clinical implication? Aggressive hypolipidemic therapy and restrictive diets are strictly necessary for those with compromised genetic machinery who cannot regulate lipid exchange. For the vast majority of the population, however, a balanced, healthy lifestyle is sufficient. Treating everyone as if they have a metabolic genetic defect often serves the interest of the pharmaceutical market rather than the patient, potentially leading to unnecessary intervention and detriment. Thanks for likes and sharing.